Hi, I'm Nicole Hadfield. I would like to welcome everyone joining us today. I would like to pay my respects to the Gamilaroi people, the traditional custodians of the land on which I'm meeting on today, and pay my respects to elders past, present and emerging and any First Nations people joining us today. Content that I am covering is a case study for an Indigenous youth with mental health in rural New South Wales, depression in Indigenous Australia, the assessments that will take place, contributing factors and the burden of disease, the mental illness prevention promotion services in Australia, pharmacological and non-pharmacological treatments, care plan, reflection, learning objectives for the audience, increasing understanding for how to support an Indigenous youth with depression in rural New South Wales, how a Wellbeing Nurse Coordinator or WINC will support an Indigenous youth with depression in a rural school in New South Wales. The case study is of a 14-year-old Indigenous male student with signs of depression. His school attendance has decreased over the last 6 months, finds it hard to sleep and get out of bed, has no friends in school or out of school, normally plays football but not this season. He usually enjoys Indigenous cultural dancing with the Gamilaroi dance group but hasn't been going, doesn't have any goals or aspirations when he finishes school, no suicidal ideation or plans, has no medical history, nor is he on any medications. So he does have depression. More than 1 in 10 Indigenous Australians have been diagnosed with anxiety and depression. 13% of these have depression. For Indigenous Australia, it is important that social, emotional, mental health and wellbeing is looked after in a holistic way, that their relationships with their family, kin, community, culture, spirit, land and ancestors are nurtured and respected. Contributing factors: 28% of Australia's population live in rural, remote areas. The impact of social determinants of health heavily contributes to poorer health outcomes due to limited access to health services, education, quality of housing and employment opportunities. Poor sleep hygiene. Current guidelines suggest that adolescents require a sleep duration of 8 to 10 hours for optimal functioning, with a recent dose response modelling study suggests 9.35 hours of sleep was required for adolescents. The client has a bit of a chaotic and unstable household. A positive family environment with low conflict or chaos has been shown to benefit adolescent sleep patterns. The burden of disease rate in rural areas is 1.5 times higher than that in urban areas. In terms of disability adjusted life years, the burden of mental disorders caused 572,775 DALYs in 2015. The high prevalence and early onset of depression amongst adolescents could largely be explained by changing environment, biological changes such as puberty and sexuality, and environmental changes such as peer victimisation, smoking, alcohol and substance use. Some prevention and promotion services. 13 Yarn is the first national crisis line that has been created for Indigenous Australians who are feeling overwhelmed or having difficulty coping. 13 Yarn is led by a team of Indigenous Australians. The website promotes that we encourage you to connect with 13 Yarn on 139276 24 hours 7 days a week, and we talk with Aboriginal and Torres Strait Islander crisis supporters. Headspace is Australia's national youth mental health foundation, providing early intervention mental health services to 12 to 25-year-olds. For the client being in a rural and remote area of Coonabarabran, the online or phone consult of Headspace would be offered. Pharmacological support. For kids with depression, experts agree that the first choice in medication treatment is a group of antidepressants, medications called SSRIs, selective serotonin reuptake inhibitors. According to Miller 2024, only 2-fluoxetine and escitalopram have the FDA approval for treatment of depression in children and in teens. The GP has commenced him on fluoxetine 10 milligrams, a lower dose SSRI for treatment of depression and anxiety. SSRIs usually take 4 to 6 weeks to have an effect on depression symptoms. The client has been prescribed melatonin also to help with better sleep hygiene. The most common preparation in Australia is a 2 milligram tablet form. Non-pharmacological support. There's CBT or cognitive behavioural therapy. There are several kinds of therapy that include cognitive behavioural therapy, and it is considered that it normally takes about 12 weeks to be trialled, and if this doesn't help, then SSRIs are recommended. There's also motivational interviewing. The school counsellor will help to guide the client in a positive and productive way. Motivational interviewing has been proven to help people to become more resilient, help people to learn the skills to provide problems solve themselves, and guide the client to possibility of change and positive growth. Assessments. As a WINC, I would conduct a HEADS assessment as part of our youth health and wellbeing assessment. The information gathered can be used to directly address any concerns or refer a client to a specialist response. The HEGS algorithm stands for H, meaning home and family. E is education and employment. The next E is for eating and exercise. A stands for activities, hobbies, and peer relationships. D is for drug use, illicit alcohol, cigarettes, and vaping. S stands for sexual activity and sexuality. S is for suicidal thoughts, plans, self-harm, depression, mood, and sleep pattern. The next S stands for safety and spirituality. Are they safe in their environment? Are they being bullied? Any domestic violence? And what's important to them for their spirituality, religiously, and culturally. The MSE, or mental status exam, is a general assessment of the patient's level of consciousness, appearance, activity, and emotional state, how well they're dressed and groomed, if they're making eye contact, and how well they're conversing. The client is if the client is not making eye contact, and in this case is not making very well eye contact. So in some Aboriginal and Torres Strait Islander cultures, it may be considered rude or disrespectful to make eye contact. And behaviour is, are they open or relaxed or withdrawn? What is their motor activity like, and how is their posture like? Are they fidgety? Their cognitive functioning, is he orientated to time, place, and person? Then there's the DAS 21, which is a 21 question on the D standing for depression, A for anxiety, S for stress scale. So this child will be referred to the doctor for this. The depression score come back as 19, which is severe. The anxiety score come back as 13, and the stress score come back as 11. The anxiety was severe, and the stress score come back as moderate. Family and support network. He feels as though he has no support from his family, even though he has many aunties and uncles and cousins in community. But this mindset may change with a bit of a mindset, maybe with some motivational interviewing. The Win did speak to Mum, which she was very supportive. He does want to go back to the Gamilaroi dance group, giving him some cultural connection. Having a strong cultural identity and knowledge helps some young Indigenous Australians to make positive social connections with people in their family and broader community and feel a sense of belonging. His strengths is that he's had community and cultural connections and willing to re-engage. Risk factors is that he's Indigenous Australian living in a rural area and he has a higher morbidity and mortality rate than compared to other Australians. In the care plan, he has many goals outlined that was attended at the GPs with his mum in support. So the client, mum, and the GP have listed those various goals that he does want to reach, and these have been supported by treatment and medication with other health professionals and connection back to culture and exercise. These are all measured by progress by each session with cognition and observation by their supports, and the GP is having another review in 8 weeks after the medication has had time to work. So there's some of the other supports there with check-in also with the WINC at the school, better bedtime, some strategies for anxiety, referrals to psychologists for sleep hygiene and help with anxiety. Lessons that I've learned: I understand that self-care of the health practitioner is vital. PERMA self-care model is one useful tool to use. Australia's high rates of mental health and suicide, particularly in Indigenous Australians. We need to continue to work together to make positive and supportive changes which are culturally, ethically and legally appropriate. We have some great prevention and promotion services in Australia that seem to be overwhelmed with referrals and clients. The telehealth, telephone and online services in rural Australia, like Headspace and 13 Young, showing that these services are very well needed. Thank you for listening. See ya.